Most people think anti-aging is just wrinkles, but one of the biggest things aging your face is actually pigmentation, redness, texture, and collagen loss, all happening underneath the skin. IPL, microneedling, laser resurfacing, laser peels, social media throws these terms around constantly, but they all work completely differently. The problem is most people don't actually know what their skin needs to target first, whether that's pigment, collagen loss, texture, redness, laxity, and that's why anti-aging gets so confusing online. So today I'm going to break down IPL, microneedling, fractional laser resurfacing, and laser peels for you. What they actually do, how they work, what layer of the skin they target, what results you can realistically expect, and what I personally tend to recommend most often for my own clients. I'm Raina. I'm a medical esthetician and laser tech with over 12 years of experience. And once you understand how skin ages biologically, anti-aging treatments start making way more sense. Stay until the end because I'm going to explain the order I usually recommend treatments in clinic, because most people are approaching anti-aging completely backwards. First, let's talk about the treatment people constantly think is anti-aging, when really it's more of a color correction treatment. IPL stands for Intense Pulse Light. Now technically, IPL is not a laser. It uses broadband spectrum light wavelengths that target melanin, which is used for pigmentation, and hemoglobin, which is for redness and blood vessels in the skin. The light converts into heat, which selectively damages unwanted pigment and vascular lesions while leaving surrounded tissue relatively unharmed. Your body then will naturally clear the damage away over time. This is why IPL is amazing for sun damage, redness, rosacea, broken capillaries, just overall uneven skin tone. Correcting color alone in the skin can make someone dramatically look younger because uneven pigmentation is one of the biggest visual signs of aging. Personally, IPL is one of the treatments I recommend all the time for the right clients because so many people have underlying sun damage they don't even realize, and it's really aging them. A lot of people want to jump straight into laser resurfacing or aggressive collagen treatments while completely ignoring the pigment and vascular damage underneath the skin. I think of it as clearing the canvas first. And this is one of the biggest reasons anti-aging gets confusing online. People are trying to treat multiple layers of aging with one treatment. Skin aging doesn't just happen in one layer. Now this next treatment works completely different because instead of targeting color, it targets the skin's natural support structure. Microneedling works through controlled mechanical injury. Tiny needles in the tip create microchannels in the skin, which triggers the body's wound healing cascade. This activates fibroblasts, which then stimulate collagen, elastin, and cellular turnover. Collagen is incredibly important because as we age, collagen production naturally declines every year. Microneedling helps rebuild some of that structural support gradually. This is why you'll see that microneedling is commonly used for fine lines, enlarged pores, acne scarring, and texture concerns. I always explain to my clients that microneedling is usually more of a collagen investment. It's not always the dramatic overnight wow people expect from social media, but over time the skin does become thicker, smoother, and healthier and more resilient. For younger clients or people wanting prevention with anti-aging and less downtime, this is one of my favorite places to start. Now, if RF energy is added, like RF microneedling, you're also delivering thermal heat deeper into the dermis, which can create much more collagen stimulation and tightening. And this is where treatment plans become really important, because not everyone needs the most aggressive treatment available. Sometimes rebuilding skin health first gives the best long-term outcome. Okay, now this is where we start getting into the treatments that create those more dramatic before and afters that you see online. However, again, usually that happens with multiple treatments. Fractional laser resurfacing works by creating microscopic columns of controlled thermal injury within the skin. Instead of treating 100% of the skin's surface at once, the laser creates tiny channels surrounded by untreated healthy tissue. That untreated tissue helps accelerate healing, while the treated areas stimulate intense collagen remodeling and skin renewal. Now, depending on the device and settings, fractional laser can either be non-ablative or it can be ablative. What that means is non-ablative fractional laser heats deeper tissue while keeping most of the skin surface intact. Ablative fractional lasers actually vaporize microscopic portions of damaged skin tissue, while also heating deeper layers of the dermis. So now we're not just stimulating collagen, we're physically reconstructing damaged skin. And this is usually where clients start seeing those major texture changes. Fractional resurfacing can be extremely effective for acne scarring, moderate to more advanced wrinkles, severe texture, enlarged pores, crepey skin, because we're working both superficially and deeper within the skin. Personally, this is usually what I recommend for clients who have more advanced texture concerns or more significant aging changes that microneedling alone likely won't fully address, especially the severe acne scarring clients. This is where you can get some really impressive transformations. I'm also very realistic with my clients. This still isn't typically a one and done treatment, no downtime, and magically perfect skin. Most clients after the treatment still experience redness, swelling, heat, kind of rough peeling texture, and that's all very normal. And depending on the aggressiveness, downtime can range anywhere from a few days up to over a week. The skin may look healed quickly, but collagen remodeling continues for months afterwards. This is why results continue improving over time. And again, most people benefit from multiple treatments because collagen remodeling is cumulative. Each treatment builds on the one before. Now let's talk about the treatment people constantly get confused with fractional laser resurfacing, and that's laser peels. A laser peel is an ablative resurfacing treatment that removes a very precise layer of the epidermis, the outermost layer of the skin. Think of it almost like a highly controlled laser peel instead of a traditional chemical peel. So instead of creating deeper microscopic columns like fractional resurfacing, this treatment focuses more on controlled surface renewal. The laser precisely vaporizes damaged epidermal tissue, which stimulates epidermal regeneration, cellular turnover, smoother texture, and mild collagen stimulation. This treatment is amazing for rough texture, dullness, superficial pigmentation, and fine lines. This is one of my most favorite treatments for that really polished, glowy skin look, especially if we've already worked on treatments that do deeper correction. A lot of clients love laser peels because the skin often looks smoother, brighter, and glowier once it's healed. Now, unlike deeper fractional resurfacing, laser peels are usually more superficial depending on the treatment depth. So downtime is often a little shorter, but results are much more surface focused. So after the treatment, you could experience redness, tightness, a little bit of roughness and peeling for 2 to 4 days after. Honestly, a lot of the time, I like to layer the fractional laser resurfacing with the laser peel strategically as part of a treatment plan because they target different depths and concerns within the skin. So now the big question becomes, where do you actually start? In my practice, for most of my clients who have visible sun damage, redness, uneven skin tone, I highly suggest starting with a couple IPL first. From there, depending on texture severity, age, collagen loss, depth of acne scarring, downtime tolerance, and overall goals, that's when I usually recommend either a series of microneedling or some laser resurfacing. Microneedling is amazing for preventing aging, progressive collagen stimulation, and mild to moderate texture. And of course, for those clients wanting less downtime. Whereas fractional laser resurfacing is generally better for advanced aging, deeper wrinkles, more severe texture issues, deeper acne scarring, and this is one of the biggest things people need to understand. Nothing in aesthetics is one and done. The skin needs time to heal in between treatments, regenerate, stimulate collagen, and remodel tissue. So for example, start with 3 microneedling treatments or a couple fractional resurfacing treatments properly spaced apart, which would be anywhere from 4 to 8 weeks. That usually creates much better long-term results than chasing one aggressive treatment. And sometimes I like to finish with a laser peel afterwards to further refine texture, brightness, and overall skin quality. Because the best anti-aging results usually come from layering treatments strategically over time, not chasing one miracle procedure. Once you actually understand what different treatments are targeting within the skin, anti-aging starts making a whole lot more sense. If you want real education on lasers, anti-aging, skincare science, and what treatments are actually worth your money, make sure you subscribe to my channel because I'll be breaking down the treatments, the technologies, and trends people are constantly confused about online.